Myocardial infarction is one of the most dangerous cardiovascular events, especially for the elderly. When we think of a myocardial infarction, we often associate it with severe chest pain, a heavy pressure in the middle of the chest, difficulty breathing, even cold sweats, and possible fainting. However, few people know that behind these acute symptoms lies a silent process that lasts many years, even decades, with the aging of the body itself being the central factor driving the increased risk. In older adults, especially those aged 65 and above, the body begins to undergo many irreversible changes in the cardiovascular system. One of the main causes is atherosclerosis. This is the phenomenon where plaques containing cholesterol, immune cells, platelets, and calcium gradually accumulate on the arterial walls, forming hard atherosclerotic plaques. Initially, this process can be very silent, causing no obvious symptoms. But over time, these plaques grow larger, narrowing the arteries and obstructing the flow of oxygen-rich blood that nourishes the heart muscle. When an atherosclerotic plaque ruptures, the body responds by forming a blood clot at the site of the injury. If this blood clot is large enough to completely block the coronary artery, the blood flow supplying the heart muscle is interrupted, causing a myocardial infarction. Especially in the elderly, the vessel walls are weakened, less elastic, and the ability to self-regulate blood flow is also reduced, increasing the risk of plaque formation and rupture even further. In addition to atherosclerosis, the aging process also leads to arterial stiffness. As we age, the components that make up the arterial walls, such as collagen and elastin, gradually change and lose their natural softness and elasticity. The arterial walls become stiffer and no longer expand well under the pressure of blood flow. This causes the heart to work harder to pump blood throughout the body, eventually leading to high blood pressure, increased strain on the heart muscle, and contributing to the risk of myocardial infarction. Another equally important factor is the change in the structure and function of the heart itself. In older adults, the heart walls tend to thicken. This is an adaptive response of the heart muscle to prolonged high pressure, often due to hypertension or other diseases. However, when the heart walls thicken, the volume of the heart chambers decreases, causing the amount of blood pumped out with each beat to be reduced. As a result, even though the heart beats more frequently, the blood supply is insufficient, and the heart muscle itself is prone to ischemia and damage. It is impossible not to mention heart valve diseases, which occur more frequently in the elderly. The heart valves are responsible for controlling the direction of blood flow within the heart. When the heart valves age, become fibrotic, or have been infected without thorough treatment, their opening and closing functions diminish, causing conditions such as valve stenosis or regurgitation. As a result, blood flow through the heart is disrupted, forcing the heart to work harder, which can easily lead to heart failure and increase the risk of myocardial infarction. Another point to note is the issue of electrolyte imbalance in the blood, typically hypernatremia. Older adults often have impaired kidney function, and their ability to regulate salt and water levels in the body is no longer as effective as before. Hypernatremia causes high blood pressure, worsening the process of atherosclerosis and arterial stiffness, thereby contributing to an increased risk of myocardial infarction. In addition to changes caused by natural aging, older adults often suffer from many underlying conditions such as hypertension, diabetes, lipid disorders, coronary artery disease, or have long-term habits of smoking and drinking alcohol. These factors all contribute to the acceleration of atherosclerosis, increasing the risk for a heart that is already weakened with age. International studies also show that the incidence of myocardial infarction increases significantly in middle-aged and elderly groups. In the United States, among men aged 50 to 59, the incidence rate has reached 27% and remains high until the age of 70,000 to 79, then slightly decreases in the group over 80 years old. Part of this is due to the cumulative nature of risk factors over time, and another part is because the weakest individuals may have experienced complications earlier. In younger age groups, myocardial infarction can also occur, but it usually appears in people with genetic factors, smokers, obesity, or metabolic diseases. However, compared to older adults, the incidence rate is still much lower. In general, myocardial infarction can be prevented if we proactively control risk factors. For the elderly, regular health checkups to detect early abnormalities in blood pressure, blood lipids, and blood sugar are very important. In addition, maintaining a healthy lifestyle, not smoking, limiting alcohol consumption, eating plenty of green vegetables, fruits, whole grains, and choosing healthy proteins from fish, lean meat, beans, and low-fat dairy products will help protect the heart. Regularly engaging in gentle exercise suitable for your health, maintaining a reasonable weight, getting enough sleep, and knowing how to manage stress are also measures that help strengthen cardiovascular health and reduce the risk of heart attacks in the elderly. The last but not least important thing is to listen to your body and not be subjective about abnormal signs such as chest pain, shortness of breath, or prolonged fatigue. Early recognition and timely treatment will help minimize the severe consequences of heart attacks, protect health, and extend the lifespan of the elderly.